a randomized trial of epidural glucocorticoid injections for spinal stenosis. Lumbar stenosis, a common cause of spine-related disability, is a leading reason for spinal surgery in older adults. Degenerative change resulting in narrowing of the spinal canal and nerve root compression can cause back leg pain, lower extremity paresthesias, and weakness. The treatment of symptomatic lumbar stenosis remains controversial. Contents. Symptoms of lumbar stenosis are commonly treated with epidural glucocorticoid injections. These injections typically contain a glucocorticoid and anesthetic, which are thought to relieve pain by reducing nerve root inflammation and ischemia. An estimated 25% of all epidural glucocorticoid injections administered in the Medicare population and 74% of those administered in patients are veteran-affiliated medical centers are for spinal stenosis. Rates and associated cause of this injection spinal stenosis increased nearly 300% over the past 2 decades, and it's estimated that more than 2.2 million lumbar epidural glucocorticoid injections are performed each year in the Medicare population.
Your doctor will give you an epidural steroid injection to reduce inflammation in your spine, reducing pain and allowing time for your condition to heal. The spine consists of bony vertebrae stacked one on the other, shock-absorbing intervertebral discs lying between the vertebrae, ligaments and muscles connecting the bones, and the spinal cord with its branching spinal nerves. The spinal cord is bathed in cerebrospinal fluid and surrounded by a protective membrane called the dura. Just outside this membrane is the epidural space. Each intervertebral disc consists
patients with spinal stenosis, but data are lacking for rigorous randomized controlled trials evaluating effectiveness and safety.
Lumbar epidural injections are performed for management of low back pain and leg pain. The spinal cord and the nerves have a covering called the dura. The space around the dura is called the epidural space. The procedure is done under local anesthetic. The doctor will initially numb the skin and deeper tissues with a numbing medicine.
Hi, I'm Matthew Coulter. I'm a physiatrist and pain management physician with Suffolk Orthopedic Associates. An epidural steroid injection is injecting a steroid into the epidural space, which is the space surrounding the spinal cord. Most times when you have a nerve compression from a herniated disc, you usually feel radiating pain from the back down the legs, which people refer to as sciatica. A person is a candidate for an epidural steroid injection if they're unresponsive to conservative treatment with physical therapy and they do have evidence of a herniated disc on the MRI. Okay, this is a normal spine. This is the disc right here, flanked by the 2 vertebrae. And the nerve comes out of the side over here, out of this hole.